Ladies and gentlemen, good afternoon and welcome to the first Zen Web CME. It's been 2.5 months since we met physically in the Zen auditorium, and what better way than to start our series of webinars, which we plan to conduct every Thursday afternoon sharp at 2:30. Our partners in this will be Medinet, a Bangalore-based IT company. We will roll this out in the next 3 months to have a certificate course on specific topics. From next Thursday onwards, for 3 Thursdays, we plan to have a certificate course in hepatology, which will be coordinated and designed by my colleague, Dr. 𝗍𝗂𝗃𝗍𝗂, Professor of Gastroenterology in Sion Hospital and Chief of Gastroenterology at Zen Hospital. I request all of you to sign up for these certificate courses, and we look forward to meeting all of you, albeit digitally, every Thursday. Our first speaker for today to inaugurate our webinar series is none other than Dr. 𝗍𝗂𝗃𝗍𝗂, who's been a teacher and friend to many of us, who's guided us through many CMEs, focusing on the nuances of the basics. And his very interesting topic today is prevention of adult diseases starts in childhood. I present to you Professor 𝗍𝗂𝗃𝗍𝗂.
Well, thank you, Dr. Roy. This was about 3 decades ago when Dr. Barker from UK developed a concept that many adult diseases started in childhood. He was not sure, but he was collecting evidences, and over 3 decades, there is a lot of evidence now created which tells us that many adult diseases really start in childhood, but they are often silent. Well, historical writers and researchers always said old age is second childhood, but the first childhood is enjoyable, but often with frequent and minor diseases. But there is a need to watch carefully. There are silent, hidden problems which exist even in childhood. They may manifest in adulthood, and if they were first seen in adults, it almost felt that they occurred recently, but many of these diseases had really an origin in childhood. And what is peculiar therefore is, today we see adults with disease of old age. You don't have to be old to start suffering from diseases of old age. On one hand, there is a lot of changing scenario. We have a population which is growing very fast. Good 30% of population is under 15 years. And we have an increasing population of senior citizens, at present around 6.5%. Average life expectancy has also gone up. But after better control of infections in childhood and many other controllable diseases, there is a total drift with chronic diseases in adult population. You have many of them: diabetes, hypertension, MI, brain stroke, COPD, allergic disorder, orthopedic, GI, renal, behavioral, and psychological. Imagine 30% of the population today have a depression. Do you think that this all suddenly came up in adulthood? Probably not. It has an origin right through childhood. And I think it would be interesting to see that today, with global burden of such diseases on the increase, we need to look at where is the origin of this story. And with this kind of a background, let me take you to a point where how far behind in childhood you could go to consider that we started adult diseases way back even in the womb. It is well known today in modern IT language, it is called fetal programming. I think our religious scriptures knew very well that the fetus was already programmed, and in many communities, after birth, within first 2-3 days, there was a special puja organized because they knew that some goddess comes and writes your destiny through life, and you have to please that goddess so that she could write a good report on your life. Imagine, centuries ago, people knew it, but they could not prove it. And Dr. Barker almost proved that there is an in utero control of lifetime health. Well, organ structures and functions are undergoing programming that ultimately would determine the psychological and also metabolic responses to later life. Imagine today, therefore, we need to start the story of origin of adult diseases right from the day of conception. And any insult during this critical phase, which extends even after birth, almost till about 2 or 3, 4 years of age, it leads to adaptation, which in later life may predispose to many, many diseases. Such setting can not only endure in later life, but also be carried out into the next generation. There is a transgenerational, non-genetic carry forward of the insult that you suffered right through early age. And I think the developing brain is the main target, and it shapes therefore a behavior pattern that this small child is going to follow throughout life. We today know that advanced maternal age could be a risk factor for Alzheimer's, and there are many such evidences coming up how right from the day of conception you start almost creating your future life with pattern either with diseases or having prevented diseases. Well, early childhood is equally important. We have several established mechanisms that cause diseases in adults. They also exist in early life. For example, obesity in childhood, insulin resistance, sodium retention, increased sympathetic nervous system activity, renin, angiotensin, aldosterone activation, altered vascular function. Many of these mechanisms, which are finally responsible for varieties of lifestyle diseases, do exist even in childhood. And of course, there are compounding factors. One of the most important compounding factor is a low birth weight. And thereafter, if you happen to be leading an affluence lifestyle, you could have an accelerated growth to which you are not really adaptable. Well, you have today's sedentary lifestyle, lack of physical exercise, improper posture, junk food, electronic gadgets, exposure to abnormal environment with a lot of other poor parenting issues. And I think this drives us to an important issue at this point of time, that though we are born with some nature giving us almost a blueprint of our future life, it's also the nurture that can ultimately decide when it would manifest. Well, there has been always a debate between nature and nurture. Nature, it's not possible to change, but nurture, yes. And I think we are talking today about what nurture can do, right from fetal age through early childhood. And there are, of course, iatrogenic factors. We doctors are responsible, antibiotic misuse, and poor counseling. Today, most of us are disease managers, but not health providers. There is a vast difference between these two terms. Health provider is one who prevents a disease, and disease managers are one who probably come into play only after the disease has set in, and there could be a limitation of disease managing. Well, in childhood is a time when you are growing, and varieties of growth disorders related to malnutrition, and today I call it malnutrition. Large number of 80% of children in India fall between malnutrition and malnutrition. Malls are everywhere now, and malnutrition has been a usual routine to see. For example, we know today that B12 deficiency leads to homocystinuria and the resulting stroke or even degeneration. You will be surprised to know that essential hypertension of adults starts in early childhood, and gradually the percentiles in hypertension is going up. Only when it crosses 95th percentile, then you start wondering whether you have a developing hypertension, and once you go past 99 percentile, you know that you have already developed hypertension. But don't forget that if a child started on 25th centile and slowly is marching upwards to 50th to 75th to 90th percentile, still you will not call him hypertension, but he is already developing hypertension. These are the windows where you could do something, not to totally prevent ultimate outcome, but certainly delay the outcome. Today we know that if I am destined to get a myocardial infarct, then it is likely I will never be able to avoid it. But a good lifestyle can delay it. And if I can delay it up to 80 or 90 years, I've almost gone through without myocardial infarction. That's the beauty of this preventive aspect. Of course, obesity with type 2 diabetes coming up in children has also been a part of the whole story. And today, it's routine to see an obese child coming with a black pigmentation over the nape of the neck, a typical parameter to say that he's already developing insulin resistance. And all these complications thereafter come in only when you demonstrate that his blood sugar has gone up. The syndrome X is what Dr. Barker came out with, and he showed that those first generation Indians who came to UK and had their children, the children had adapted to the previous generational environment, which was often a minimum nutrition. But this new generation in UK, a second generation, was easily having an access to better lifestyle, to better nutrition, and maybe also sedentary habits. So when they were programmed to be adapted only to a poor nutrition, they started getting a lot of nutrition. And this was termed by Dr. Barker as syndrome X. And today it's not rare to see a young adult, a middle-aged adult with myocardial infarction, hypertension, diabetes, and whatever. I think the origin starts right during the growth period. Well, we are today witnessing a lot of immunological disorders. Well, when we started controlling infections in childhood, our immune system had to continue with a drill, almost like the army continues to make a drill even in non-war situations. Our body continues to operate on immune system, but there is no infection. You are extremely hygienic. You have prevented a lot of communicable infections, and the result is your immune system starts practicing having a drill against many other inorganic or organic matter, and that's what is called allergy. Well, there is a theory of Th1 and Th2 hypothesis, which only means that if your immune system does not face any infection, it has to practice its skills against non-infective elements. And that's what we call it as an allergy. And today we find lots of immune disorders even in childhood. Of course, immunodeficiency is something you may be born with. Don't forget that malnutrition and malnutrition both have a lot of immune deficiency. Children with obesity are not immunologically strong, as much as children who are malnourished are also not. You have a lot of immunoreactive disorders today. For example, a juvenile idiopathic arthritis or an inflammatory bowel disease. All these conditions are now being seen more and more in children and diagnosed pretty early. And of course, you also have a third type of an immunological disorder, and that is your immune system is totally disorganized or imbalanced, and that leads to malignancy, cancer. Today, even prevalence of childhood malignancy is on the increase. Now, what is worst is all these immuno disorders like immune deficiency, immunoreactive, and immunoimbalance, they overlap each other. And a patient with HIV, immune deficiency, also develops a Burkitt's lymphoma, a malignancy. So you have a multiple kinds of disorder. And today we see a disease like Kawasaki, which affects even infants. And the sequelae is the coronary artery dilatation. And it's not far off that we would see a 10-year-old and a 15-year-old coming with a myocardial infarct, a result of immunological disorder, having suffered very early in life, like a Kawasaki. And of course, the IBD, as I mentioned. What is peculiar with IBD in children is it is known to have a very frequent relapses. Same is the story of childhood asthma. If a preschooler starts wheezing, maybe once or twice in a year, often he gets better over the age of 5 or 6 years and he stops wheezing. But those who continue wheezing beyond 6 years are likely to have a permanent asthma, which is one kind of a lead to a COPD in adulthood. And then you have, of course, a hypothyroidism. You have a celiac disease. Look at what the immunology does. There is a wide spectrum of clinical manifestation. It's not that celiac disease will be seen right at the age of 10 or 12 months when a child is introduced to wheat. Oh, celiac can come in an adult for the first time, even when this adult has been consuming wheat all the time. What have we learned out of all this? That immunological disorders are now going to be seen more and more as we prevent communicable diseases, infection by good vaccination, etc. The point is, should we therefore suffer from infections? And should we stop immunization? No. But you need not be too hygienic. Of course, in India, we don't have to be careful about hygiene. We are always unhygienic. When you follow hygiene to the best of your ability, you have enough of unhygienic situation. But what I mean casually is, it's good to have a roadside pani puri once in a while. Might give you a chance of some infection and may avoid some immunological disorder. Well, many genetic disorders are inborn, but manifestations come much later. Therefore, today, many Western countries have a screening program for at least common metabolic disorders. In India, many good centers have started screening for hypothyroidism, for example, G6PD, maybe some more, depending on the affordability. US almost screens about 25 disorders right on cord blood. The idea is many of them are preventable if you take appropriate action. Like if you pick up a hypothyroid on a cord blood, you start the thyroid replacement therapy, and you have prevented this child from getting brain damage or a growth retardation. How important it is. Same is the story of many other metabolic disorders, and one could imagine today that again here there is a wide spectrum. Some of them you are born with but may manifest later in life, and many of them may get aggravated by even a simple viral infection. Then of course there are syndromic defects. Take example of an epilepsy. And an adult who throws an epileptic fit for the first time is already born with an abnormal brain currents that is likely to develop epilepsy. He just needs some trigger. But what is most worrying today amongst all syndromes is autism spectrum disorder. I must say over last 50 years of my pediatric exposure, last 15, 20 years, we started seeing autism spectrum disorder. We never saw it earlier. Probably it did not exist as much, because if we had missed, we would have seen adults with such a disorder, which we did not. But today, we have an increasing prevalence of autism spectrum disorder. It's a genetic disorder. So it must have been there with you and me, maybe, but we did not manifest. Why did we not manifest? Because we had a better environment. Nurture was good. It's my feeling. I have no evidence to say that. But just 30, 40 years ago, when a baby was born, everybody talked to the newborn. When a mother gave a bath or a massage, the mother talked to the baby. Oh, how lovely you look. How good you are. The communication in life started at newborn level. What is autism spectrum disorder? A disorder of communication. Today, in a house of 3 or 4 rooms, each one has a room to himself, and you communicate with each other through WhatsApp or through email. I think no wonder the environment has changed, and we see a lot of autism spectrum disorder. And there are many such defects which also come. What I want to drive at, early diagnosis may prevent many of these chronic disorders. And today, if a child at 1 year of age, when you call his name, if he doesn't look at you, you suspect autism spectrum disorder. So simple. But you need to call his name. And unless you have been calling his name, he won't know that's his name. Again, a problem of communication. And I'm sure the poor communication between individuals, between family members, continues thereafter, and ultimately leads to a lot of behavioral disorders in adulthood. I think last point in this prevention I like to talk is the childhood rearing practices. There has been a lot of change created while the parenting has been totally now different. I think the infant creates his mental model that serves a guide for his later life. What I mean by this is, if an infant and a toddler is well behaved with, respected, then he learns to respect others in life. And I think it is so important that you must have a good parent-child relationship early in childhood, which ultimately will decide what kind of behavioral pattern that would last. And I'm sure today there is enough evidence that it lasts from right cradle to the grave. So important is an exposure of parental relations with children right from infancy and through childhood. And if you see the Western model, that is what has gone wrong. And in large affluent societies in India, we are almost following the Western model. Well, we know that child abuse leads to depression and child stress. It ultimately leads to many behavioral problems like anxiety, aggression, and I think all these social issues are due to poor parenting practices. Today's environment is very conducive for all that. Good 40-50% of parents cannot afford to look after their children well for varieties of reasons, and those who can afford also may not do it well. And I think this is one area where we are now going to find more and more behavioral issues. If I see 10 children with a chronic abdominal pain today, believe me, 5 or 7 or 8 of them will have possibly a non-organic cause, purely non-organic, psychological, behavioral, and it's getting common. Today, that's the first possible cause of a chronic abdominal pain in a child who is otherwise doing well. I think we need to therefore have a role model of parents. And what kind of role model? We need the authoritative parents, not authoritarian parents. Authoritative parents promote discipline also with love. You allow your adolescent to do what he wants, but under a distant supervision. I recall a friend of mine who asked me, what does it mean? And he said his adolescent boy wanted to stay overnight in his friend's house. Should he allow it or not? I said, by all means you should. But you should know who is this friend, where does he stay, what is his parents like. But you can't ask him these questions. He doesn't like it. So all that you could do is, you could say that, look, I would drop you to your friend's house so that I will also get to know his parents. Now, that's the way to keep a distant supervision. But the authoritarian parents would say, no, you can't go. The lenient parents would say, you do what you like. And this is where we need authoritative parents to bring up their children. And I think some of them are permissive. Some of them are totally uninvolved. And I think these are the parents whose children are likely to meet with a lot of other practices. I think I just gave you an overview of many things that could go wrong, in which we are focused as disease managers only on diseases of the structures of the body, the organ, but we often now face functional disorders, function that is equally important as well as just the structure. So just to summarize what I had to say is that we have increasing lifespan today, but we want quality survival in old age. It is too late at that age to offer help. We need to address the problems right from early life, as early as possible. Those of you who have children of adolescent age group are still not too late. But you have grandchildren, you start looking at it closely and let your children know how they should be expected to be raised. And I think we need to look at medically right from improving birth weight. Today, 30% of babies in India are born low birth weight, less than 2.5 kilograms, and they start their life with already problems on hand. The problems that could come up later. Of course, exclusive breastfeeding is so important because it has a bonding, and that bonding is very, very crucial in developing ultimately the kind of bond that this child, having grown into adulthood, would have with others. Of course, timely complementary foods. I think we need to look at organ-specific lifestyle. Today we know that when you look at the brain, it is not IQ, it is EQ, emotional quotient. It is SQ, social quotient. But also it is AQ. What is AQ? Adversity Q. A child should be prepared to face adversities in life. And today we have IQ, SQ, EQ, and AQ. Unless all four quotients are nurtured through childhood, one may not be able to meet a very healthy adult by classical standard. Pediatric lung health is very important, and today, with a lot of pollution outside, every child today is going to be tomorrow's lung crippled. So what do? We need to have a good breathing exercises. We just had an International Yoga Day 2 days ago. It's the way to breathe well. I'm sure all of you as doctors know that majority of us, even as doctors, don't breathe well. So we lose a lot of lung power right from early age. And that then, having faced the pollution, gets into your chronic lung disease. Of course, heart, you need to have an anaerobic and aerobic exercises to keep the myocardium going well. And kidneys are equally important. Today, it is unfortunate that large number of patients who are taking dialysis for a chronic renal failure are middle-aged adults. What went wrong? They did not look after their kidneys during childhood, which means we doctors failed. This is one very important area, and kidney is a silent killer. We need to be very sure. What about the intestinal tract? Earlier generation knew that intestines govern the health. And today we know intestines also monitor and govern the brain. You will be surprised to know that it's intestinal hormones and enzymes which totally control brain. When you see something very frightful, first thing happens is a cramps in the abdomen. पेट में गोला आ जाता है. Which means intestines see the fright first, but they don't know what to do. They send a message to the brain, and the brain decides. But intestine monitors the brain. And you know that when you are going for an exam or an interview, you feel like going to the loo once more. Intestines are the first to see the stress. And when you ask me, how do you know it? I say, it's my gut feeling. Oh, superior to brain feeling. It's so important to keep the gastrointestinal tract in good action. And earlier generation used to give castor oil every Sunday as if to 𝗍𝗶𝗿𝗀𝗍𝗍, which is not necessary, but it amounts to a right kind of eating habits, a diet. And of course, joints. You need to see that the joints are well used, but not in overuse. Clive Lloyd, who was a West Indies captain, had a knee joint replacement at the age of 35 years. He asked his doctor, why so early? The doctor said, you have already used the knee as much as nature could want you to use. Overuse is also likely to be bad. And you can imagine we could have an organ-specific lifestyle. And I think parents have already said about the IQs that you promote. And I think what is important is we should diagnose potential serious diseases early. I made a mention of Kawasaki. Today, if you miss Kawasaki, the patient may get well, but would be left behind with a coronary artery dilatation. And at the prime age of 10 or 15 years, he would possibly develop an MI. He would come with a left-sided chest pain, and nobody would ever think that it's an MI. We have such threats. Today we see children with fever getting antibiotics irrationally. They could be having a urinary infection. And if these UTIs go unnoticed, every time partially treated, one very important cause today of a chronic renal failure is abuse of antibiotics. I feel, therefore, at the end of the story, I want to realize that those who have young children, those who have a chance to modulate their lifestyle, this is the time, this is the last chance. And once these habits get instilled into childhood, oh, they are die hard. And I think that's how it helps second childhood to be enjoyable. We just don't want old age. Of course, old age is a luxury. Not everybody sees it. But it should not be an old age that is with all trouble. If we follow all these preventive measures at any age, earlier the better, of course, you will die young, but as late as possible. Thank you very much.
Thank you very much, Dr. Ambekar.
Yes, yes.
There is a question for you from Dr. 𝗱𝗂𝗃𝗃.
Yes.
What are the metabolic problems when the baby is born low birth weight?
Well, I think what I meant was silent metabolic problem. Well, there are many metabolic problems which can occur even right at birth. Many inborn error of metabolism. But some of them are silent and may manifest later. For example, you have a congenital adrenal dysplasia. Now, this is a condition which can present even in adult, but is there right from beginning. Today, all these disorders are being screened on cord blood. In India, many centers have started looking at 6 common conditions which are prevalent in India. And what is common? Hypothyroid is common in 1 in 3,000 live births. It's so common. But US can afford to screen 25 even if it's 1 in a lakh. Point I made is that hypothyroidism has to be picked up today at birth. It's cheap. It costs just 200 rupees and it saves the brain and the growth of an adult. I think this is where I said about the metabolic error.
I think there are many more questions, but I think our time is about 45 minutes. Thank you for an excellent talk. We enjoyed having you with us.
Thank you very much.
We appreciate your spending time on the afternoon
Thank you very much.
For the rest of the audience, I think next Thursday we begin our series on hepatology. I think our speakers will be Dr. 𝗂𝗂𝗃𝗃, Dr. 𝗂𝗏𝗏𝗃𝗃 from 𝗀𝗏𝗃, and Dr. Amit Mandal from Bombay Hospital. I look forward to having you all with us, and I thank Dr. Ambekar once again for his time today. Thank you.
Thank you. Thank you.